Wearing his blue surgical cap and hospital gown, 29-year-old Keith Holmes gives our camera a wave as his care team goes over the basics.
All right, can you tell me your name and your date of birth one more time?
Next, they inflate the mattress underneath him. It's so they can smoothly slide Keith from his hospital bed onto the procedure table. Within seconds, he's sedated and asleep. After some prepping, it's time for his interventional cardiologist, Dr. J.D. Surface, and cardiothoracic surgeon, Dr. Trip Zorn, to step in. They'll be replacing an artificial heart valve that Keith got back in 2014. It was when he was 18 years old and still a patient at Children's Mercy Hospital. He's now in the care of the Adult Congenital Heart Disease Clinic at the University of Kansas Health System. The procedure today is called a transcatheter pulmonary valve replacement.
I just wanted to jump on top of things and get it done.
Keith's heart problems have existed his entire life. He was born with 4 heart defects that together are called tetralogy of Fallot. You may even hear people call it blue baby syndrome because the low blood oxygen levels can cause baby's skin to look blue. Today, there will be no cutting through his chest. Watch as the doctors work side by side with the rest of their team, inserting a small tube called a catheter into Keith's groin. Next, they guide the catheter through his femoral vein all the way up to his heart. This tube provides a clear path for the doctors to implant the new valve you see here. They'll use small tools and a wire to help.
Yeah, that looks great.
Dr. Surface and Dr. Zorn can see their work inside him using the large monitors above the table.
I'll have control of your valve, you'll have the wire.
Despite having numerous procedures and surgeries over the course of his life, each one turning out fine, before this one, Keith confided that if he's being honest, he's still nervous.
Every time I'm always nervous. I've always been nervous.
And who wouldn't be? But he knows these procedures are part of living with a congenital heart defect and are what make it possible for him to get back to living his happy, healthy life.